Look, if you're moving to Mexico, you're going to want to know about healthcare costs, and insurance. From everything I've seen and experienced after living here for a year, I can tell you it's very good and reasonably priced. I'll walk you through our experience here and how we got our insurance and how much it costs for healthcare for us here in Mexico. As a first step, we had to get insurance through a broker. From what I understand, you don't pay any more when you use a broker. Just like the US, they get a cut from the insurance, so it's a no-lose proposition. Hiring a broker was necessary anyway, as there are many different private insurance healthcare plans in Mexico. We hired Bethany Neumann, who was recommended to us by a friend, and I'm putting her contact information in the description below because she was really helpful. Even with her assistance, it was not a matter of a few mouse clicks to get the insurance. There are many steps we had to go through before actually getting our insurance. Adding to the pressure, at the time we were actually paying for health insurance in the US, which of course we weren't even using, but we felt like it was important to have some sort of catastrophic coverage while we were waiting for our insurance here in Mexico. The relatively easy part was picking a company and a plan to suit our needs from what Bethany found us. Then we had to fill out an application along with extensive paperwork which included all of our medical records from our providers in the US and an exhaustive medical history which also included our entire lives. We also then had to get exams from our doctor, a write-up from our doctor, lab tests, and I even had to get an EKG. My Apple Watch monitor for EKG apparently did not count. By the way, if you don't have a doctor in Mexico, your agent will be able to provide someone for you. Then we had to submit all of this electronically, and then we had to wait a few weeks for underwriting to respond. I'm in really good health, and even after passing all my exams, I was told my epilepsy, which I've controlled for the last 30 years and has never cost an insurance company a dime, was a significant pre-existing condition. Although I was willing to accept the risk of having a seizure and paying for any problems associated with that, I was not able to get a clear definition of what problems might be thought to be associated with my epilepsy. So I was concerned the insurance company might use their discretion and just not cover something that, truly wasn't unrelated. So that was a showstopper for me. Then we had to find another insurance company and go through the entire process again to get full coverage. From start to finish, it took us about 3 months, but I can tell you, for us, it was definitely worth it. Bethany found us a policy with Vumi for something similar to what we had in the US, which was like a $5,000 deductible policy, and our coverage ended up costing us only $400 a month compared to the $3,000 we were paying in the US. And here's the kicker, the policy covers us for any country in the world except for one, which, you guessed it, is the United States. So anytime I travel, I don't need travel insurance, except when I go back to the United States, which is quite ironic. Also, from what I understand, in general, because healthcare costs are so much lower here, you end up not even getting close to your $5,000 deductible. And along those lines, I'll give you the information I have for doctor's costs here. First off, we live in one of the most expensive areas in Mexico, so our prices are probably on the high side, but for our primary care doctor, he spends about an hour with us each time we see him. The cost is around $50. When my mom came to visit, I took her to a different doctor who spent around 30 minutes with her, and that cost around $25. I have a friend in Oaxaca who pays around $10 when they see their PCP. When I went to a GI doctor specialist, I spent about an hour there. I saw a nurse and 2 doctors, and all that cost just about $50. I've also had several lab tests done, and again, it seems to match the out-of-pocket that I got in the United States, which is around $10. I'm happy to say I haven't had any surgeries or accidents here, but I do know a neighbor whose kid broke their shoulder, and I believe it cost him around $850 from start to finish, and that included a surgery. So I think there's a pattern here, like where most of the stuff ends up costing you what it actually would cost you in the States for your out-of-pocket, and the insurance actually never even comes in. So as you can see, it's pretty clear that your overall healthcare costs in Mexico are much lower. For medications in Mexico, it's different here. The insurance plans, for the most part, don't cover your medications until you hit your deductible. But I can tell you most medication cost ends up being about the same as it was in the US, even with the insurance deductible. For example, my medication back home, it's called Vimpat, and essentially it cost $30 a month, and that's with the insurance paying and everything. Here, insurance is not involved. Go to the pharmacy, I pay $30 for Vimpat. So same cost out of pocket. Also, what's really nice is that you don't need pre-approval for your medication here, as you're obviously just paying the pharmacy directly. I can't tell you how many hours I spent on the phone with my insurance, going back and forth, sending faxes, sending forms, just to get pre-approval done and just to pay my $30 a month for my medication that I've been prescribed for almost my entire life. I mean, it's simple here. I just find my pharmacy, I pay my $30, and boom, we're done. To be fair, the pharmacies here are not as electronically connected, as they don't have the apps, they don't have the websites. You usually have to go with actual paper prescription and the name of the medication, or sometimes just the name of the medication, because a lot of the drugs here don't require prescriptions. And you hand that to the pharmacy, and then they hand you your medication. Again, at the end of the day, I don't think it costs more here, and it takes about the same amount of time to get your medication, except you don't have the same frustration factor. Now, the one big con that I mentioned before is for the pre-existing conditions. It's much worse here than in the US, and frankly, that's probably why the insurance here is so much cheaper. However, you can get around this by going to another company like we did, providing them with lots of records, and then they can evaluate whether you're an acceptable risk to them. Also, worst case scenario, they'll give you a year and they just carve out your pre-existing conditions. As I mentioned before, that's not optimal, but you still have the option of having that waiting period. That's the reality. Another issue is if you're older, it's going to be more expensive for coverage, apparently regardless of your health condition. I heard if you're over 70 years old, you're going to have problems. This is anecdotal, but several people have told me this. But if you're a US citizen, you have the option of going back. You qualify for Medicare, and that part of your life will be covered. I mean, schlepping back and forth to the US isn't ideal, but again, it's a backup and you're going to save a lot of money. Or, like us, you start earlier, get your Mexican insurance, and you keep it. And then when you hit age 70, you'll still be able to keep it at a very reasonable rate. And that's just another solution. But of course, you have to get here before you're 70 years old. Best part of health insurance in Mexico is when you go to the doctor's office, they don't ask, what kind of insurance do you have? They just ask, how you doing? That's really nice for me, and it's a big change of pace in the US, something I totally appreciate. The other best part is depending on your age, medical conditions, and the amount of coverage you want, your healthcare costs are going to be at least 75% lower, or maybe even more than they were in the US. It's a big number. Also, the hassle of health insurance, except for the part of getting it here, doesn't apply as you're rarely going to use it. When I was researching this, I was looking back on my old health insurance emails, and there were a ton. And it brought back all the memories of dealing with the health insurance companies. Now I just pay a reasonable fee, and I don't have to dedicate an area of my life dealing with health insurance. So score another point for Mexico and being an easier place to retire or live for US expats. And feel free to hit me up with any of your questions. If you found this valuable, don't forget to like and subscribe, and stay healthy out there, and I'll see you guys in Mexico.